Hi, everyone. My name is Dr. Michael Wald, the Blood Detective. Thank you so much for joining me today for this conversation, which I've entitled Causes of Hair Loss. And as you can see from this illustration here, the causes could range anywhere from autoimmune conditions to endocrine or hormonal problems. So we're going to get through every one of these and some other causes of hair loss because it's probably not a biotin deficiency. Many of you, if you're concerned about hair loss and have done any kind of research, biotin keeps coming up. Biotin, biotin, biotin. I've never seen it resolve anyone's hair loss. Never. Not one time in 33 years. So having said that, let's get into it. And in terms of my background, I'm a doctor of chiropractic with a board certification in nutrition. I have a master's degree in nutrition. I'm a sports nutritionist and dietitian. I'm a life coach. I provide acupuncture to my clients, and I have an MD diploma, but not an active license to practice medicine. So this great information that I'll be imparting to you today is for your education, and only educational purposes. It's not meant as a substitute for sound medical or health advice. So let's get into it, and we'll start first with autoimmune causes of hair loss. So immune cells attack the hair follicles, halting normal growth cycles. Inflammatory cytokines, those are just inflammatory mediators. They also damage the hair follicles because they circulate there through the blood vessels. Chronic immune activation depletes nutrients. So if you have, let's say, lupus, or you have scleroderma, or Sjogren's syndrome, or multiple sclerosis, or Hashimoto's thyroiditis, you are going to have a situation where your body hyperutilizes nutrition, and as a result, or one of the potential results of that, is hair loss. And then there's malnutrition. Now, each of these hair loss causes, I just reviewed autoimmunity, now I'm getting into malnutrition, they commonly intermix. So these are not necessarily separate. You can have an autoimmune condition and have malnutrition and malabsorption and some of the other issues. So keep in mind that they may be blended together. You may have one or more causes of hair loss. As far as the malnutrition, we're talking about insufficient calories, insufficient protein intake, which will reduce keratin and collagen production, which will cause hair loss. And then there's vitamin and mineral deficiencies. Having those deficiencies will impair follicular metabolism and regeneration. The follicles are just not going to grow if you don't have certain vitamins and minerals. And then just poor nutrient intake overall weakens scalp circulation and immune resiliency. And I mentioned malnutrition. That's very much the same as undernutrition, but I kept it separate because I see lots of women and men, mostly women, that are obese or overweight, and they have what's known as overconsumptive malnutrition. They consume a lot of things, a lot of calories, but poor nutritional quality, and they have hair loss, you see. So long-term calorie restriction leads to hormonal imbalances and slows follicular turnover. Depletion of amino acids, in other words, from undernutrition of amino acids and fatty acids, very important fats, limit new hair shaft formation. And then undernutrition might result in cellular energy deficits, which will inhibit follicular recovery after stress and illness. So various stressors can put the body into a hair loss situation or very close to it. And then we have circulation issues. Poor blood flow restricts oxygen and nutrient delivery to the follicles. So if you have atherosclerosis or hardening of the arteries, that may include the blood vessels which supply the head and scalp, and then you will have poor blood flow and therefore less nutrient delivery, less oxygenation, and we have death of hair follicles and impaired growth. And then reduced scalp perfusion of blood and everything that blood has to offer will delay also waste removal and cell repair. So I have clients which sometimes their hair loss was caused by too much lactic acid in their bloodstream. And once we removed the lactic acid, the hair came back. And then there's chronic vascular tension, which means we could have blood vessels that are, let's say, in a very highly stressed individual. So the nervous system tells the muscular layers that are inside the blood vessel tube to constrict. And that's vascular tension, and that will result in decreased follicular or hair follicle vitality and density. And for those of you who are thinking about it, I chose to shave my head, just in case you're wondering what a clean-shaven guy has to do about hair loss conversation, but you will continue to see in a few more moments. Then we have lymphatic flow problems. Impaired lymph drainage is a problem because that will allow toxic accumulation in the scalp and will come in contact with the follicles. We have congested lymph vessels that could, from inflammation, autoimmunity, toxicity, for example, will lead to local blood vessel inflammation here and also inflammation of the hair itself. So sometimes the dermatologist will inject the head with steroids. This is a waste of time. It may improve some hair growth temporarily at the site of the injection of the steroid, but you can't inject the whole head. And even if you could theoretically do that, that's not something that's unhealthy, because although it's a local injection, a lot of these steroids become systemic and then they cause other problems, including stressing the adrenal glands and causing adrenal atrophy, which commonly results in hair loss. And then we have stagnant lymph flow, where that lymph flow just isn't moving through the lymphatic channels. That'll restrict nutrient and immune support to these follicles, and they will fall out and die prematurely. And then neurological. We have to always talk about stress. Chronic stress and nerve dysfunction increase cortisol levels in the body, and those levels circulate to the follicles, shrinking them. And also impaired nerve supply alters scalp blood vessel tone and nutrient delivery. So a person can have a neurologic disease of the nervous system, which will affect the blood flow to the head. But also the nervous system innervates or goes to every tissue, cell tissue, and organ in the body. So any neurological condition could cause a hair loss. Neuroinflammation, that's inflammation of aspects of the nervous system, disrupts signaling needed for hair growth cycles. So there are chemicals that are produced in the body which go to the hair follicles, which give them a message to either make hair or not. And when we have impaired neurological issues and neuroinflammation, that disrupts that signaling, and therefore the hair growth cycle is diminished. What about respiratory, having to do with oxygen? Low oxygen saturation reduces follicular energy metabolism. You have a circulation issue, it's going to affect your hair growth, which is why so many people as they grow older have thinning or complete loss of hair. That's symptomatic of this, the general metabolic problem here of poor oxygenation, among other things. Poor lung function limits delivery of oxygen-rich blood to the scalp tissues, so sometimes just improving your anaerobic health will improve your hairline. And then hypoxia, which is just a fancy term for low oxygen concentrations, that will trigger follicular maturation and premature shedding. So the follicles will simply not mature to the point of hair growth. That will happen in some with oxygen impairment. In terms of the gastrointestinal tract, I mentioned already malabsorption, which reduces nutrient uptake essential for keratin production. Dysbiosis, which is a term that refers to the intestinal milieu of bacterial balance offset, and that dysbiosis increases systemic inflammation and immune stress, and very commonly will cause loss of hair. And low digestive enzyme activity, that impairs protein and mineral absorption. So sometimes giving a person the right oral digestive enzymes will work wonders for their scalp. And what about endocrine or hormonal? Well, hormonal imbalances of the thyroid, the adrenals, the ovaries, for example, we know they disrupt hair growth phases. Excess androgens, which are hormones known as DHEA, dihydroepiandrosterone, produced by the adrenal glands, and testosterone, produced by the Sertoli cells of the testicles in men. And issues with those will shrink the follicles and increase the shedding of the follicles. And then low estrogen has been known for quite a long time to reduce circulation and collagen support for scalp tissues. And I also should say that hormonal fluctuations from menstrual or menopausal changes also will cause hair loss. And then as far as the genitourinary system, the kidneys, for example, or any urinary dysfunction can affect the clearance of toxins from the body. So if you have any level of kidney failure or kidney disruption, toxins will not be eliminated. They will circulate to the scalp and cause issues with hair growth. Fluid retention, which obviously is maintained through the genitourinary system, alters scalp microcirculation and oxygen delivery. So not having enough fluid affects the oxygen and just the circulation to the scalp. So what are some of the tests you might want to think about to get to the bottom of things? Well, of course, depending on your unique situation, I might run very different tests than these. I might perform some of these tests, and some people I don't perform any of them. We choose to guess and prioritize our approach based on a more detailed conversation. And I'm pretty good at it. I've been doing this for over 33 years, so I can pick these things out pretty quickly in terms of which are the more common causes of hair loss in a person and which are probably not. But the minimum to consider at least should be a comprehensive hormone and thyroid panel, which has the whole thyroid in there, plus those androgen hormones, the DHEA and testosterone. And then we want to know about circulation and hemoglobin and all of that. So ferritin, iron, and total iron binding capacity, very important. Because if you are iron anemic, that will result in oxygen delivery issues, which can result in poor nutrition delivery, poor oxygen delivery, and inflammation to the hair follicles. Hair loss starts. Then a vitamin and mineral panel to look for B12 and folic acid, zinc, biotin, vitamin D, and other nutrients, depending on the person's specific case. And then an oxidative stress and inflammation panel, because we know that stress and inflammation, oxidation, are known contributors to hair loss in almost all the cases. And then possibly a comprehensive digestive stool analysis to look more into the gut and digestion overall, because problems in the intestinal tract do commonly cause gut issues. I mean, even the dermatologists recognize this, although they probably don't know it, because for hair loss, they will sometimes give antibiotics. It doesn't work. And then autoimmunity reactive panel. You want to look for autoimmune conditions because many autoimmune conditions will result in hair loss, many of them. And then metabolic and circulatory function, looking at the balance of blood sugar and insulin, lipids, blood fats like cholesterol, LDL, HDL, triglycerides, and then nitric oxide levels. Nitric oxide is a vasodilator. It's made by blood vessels. So if my finger is a blood vessel, the nitric oxide is made in this. If we have enough nitric oxide, we get vasodilation. That's great. But if it's not there, we have vasoconstriction, and that's lack of delivery of oxygen and nutrition, and then hair loss will result. So basically the procedure I have is I sit with a client, I keep all of that in mind, and then we figure out based on the test results or some clinical guesswork what nutrients we need to start with. I will give them levels of nutrients that are in the optimal range for them. That means the what's known as an orthomolecular range. That's the optimal dose for a person, not just the recommended daily allowance. The recommended daily allowances are too small to impact hair loss much unless the person is just frankly malnourished. Then they'll lose hair, and then any amount of nutrition usually will return some of that hair. And then considering medications and drug nutrition interactions, they can be precipitating hair loss. Lots of people do not know that the medications that they have been taking, which may not have caused hair loss at one point, may be causing hair loss for them now. So important to get that all straightened out. So thank you everyone for joining me today for this podcast presentation. Another one that you've requested. I had a lot of fun doing it, and I'll see you at the next podcast. Thank you.